This conference will now be recorded.
Hi, I'm Alicia, Dr. Kowalchuk. I'm with the Department of Family and Community Medicine here at Baylor College of Medicine. I'm board certified in both family medicine and addiction medicine, and I'm going to be chatting very briefly today about the opioid epidemic and hope to see many of you at the Waiver primer training next Tuesday evening on the 31st of August. So let's talk a little bit about the opioid epidemic and why it might be really important for you as a primary care clinician to get involved with treating folks in your practice with opiate use disorder. And I'm going to ask for the slides to be advanced. Thank you so much. So in our very brief time, this very brief video, I'm going to describe recent trends in opioid use across the US, as well as overdose deaths, and discuss a few ways to effectively address the opiate epidemic in a community. So how do we help people recover and sustain health that have been impacted by opiate use or opiate use disorder? Well, we know that the opioid epidemic really kicked off with treating chronic pain with opioids. And so we really need to find better ways to address chronic pain, recognizing now that there's little role for opioids in treating chronic non-cancer pain, and that most acute pain requires at most 3 to 7 days of opioids for management. And then we definitely want to link those already with an opiate use disorder that have chronic pain into treatment, especially medication treatment. We also want to help prevent overdose fatalities and again, link people with opiate use disorder to care. So making overdose prevention and response, including naloxone kits readily available throughout the community. If we're prescribing opioids to patients for acute or chronic pain, making sure they have a naloxone overdose kit and know how to use it, and that their family or loved ones that might find them in overdose knows how to use it. And increase treatment resources within our community, which is really the primary goal of these Waiver trainings, including the primary training coming up next Tuesday. So we have seen pre-pandemic some progress on the opioid epidemic, particularly around prescription pain reliever misuse. And this is from the 2019 National Survey on Drug Use and Health Data from SAMHSA. This came out in the late summer, early fall of last year, 2020, and we're waiting on the 2020 NSDUH data to come out, which should be any day now. We know from that data that about 10 million people misuse their opioids. That's 3.7% of the US adult population, and that's prescription opioids. And heroin users were much less of that proportion. And then prescription pain relief misusers and heroin users, there was some overlap there in that population of folks. And primarily we're looking now at hydrocodone and OxyContin. Next slide. So you can see these trends, they look positive. So we see decreases in pain reliever misuse stepping down since 2016, a steady decline in pain reliever use disorder. So a formal diagnosis of an opiate use disorder and starting to misuse pain relievers has declined most significantly 2018 to 2019, just before the pandemic. Same thing with heroin use, even steeper curves here for decreases in any heroin use disorder, and starting to use heroin. We had a little bit of a bump in 2018, but we're back down and below 2017 data in 2019. Next slide. Again, another way at looking at these data by age range. And so this is opiate use disorder declines across multiple age ranges. For those 12 to 17, we saw it drop. 18 to 25-year-olds, so adolescents and young adults. For those 26 years and older, we also saw a decrease, and overall, age 12 and older, we see that decline, which is good. At the same time, and not surprisingly, we saw gains in treatment. So the number of individuals receiving medications for opiate use disorder have increased across this time period as well. So not surprising, you have a disease that has effective medication to treat it. We see the disease state go down as we increase access to treatment. And people are successfully engaging treatment with effective medications. So we see that the number of folks on methadone increased again from 2016 to 2019, buprenorphine and naltrexone. And again, the total number receiving any of these medications that have been shown to be effective and are FDA approved for treating opiate use disorder increased across the board. So far, all good news. Next slide. A little bit of bad news in that 2019 data was that although opiate use disorder decreased significantly, and we saw increases in treatment, people receiving medication treatment, we still saw overdose deaths increase by approximately 4.5%. And that seems to be now primarily driven by illicit synthetic opioids like fentanyl. And so that really speaks to ongoing work. Unfortunately, over the course of 2020, in the height of the COVID-19 pandemic, we've seen overdose deaths increase again by 30%. So not 4 or 5%, but 30%. So really skyrocketed. And we think that this is due to increase in stressors, both financial and caretaking stressors, as many schools were closed for all or part of the school year. A real isolation from recovery communities, so increases in relapse for those with a prior opiate use disorder that were in recovery. Change in what substances were available. So initially we saw a drop in some illicit substances and disruption of supply chains across borders, but that rapidly shifted again, and we saw a resumption of those routes of distribution. We've seen a decrease in access to care with the loss of employment, loss of insurance, and then a lot of treatment facilities have had restrictions on new patients that they're taking, their ability to take on new patients given pandemic protocols that are in place to ensure their safety of their, particularly in residential treatment settings, and a switch to all online treatment modalities, particularly for medication therapies, excluding methadone. And for some, that's mean an increase in access, but for many who do not have reliable internet connections or devices, that's really further limited access to care. So opiate epidemic solutions really require a multifaceted community approach. As primary care clinicians, we want to be judicious about opioid prescribing. We want to use the PDMP resource, which has been state law here in the state of Texas for over a year now, to check with every controlled substance script. We want to make sure that we're educating ourselves and educating our colleagues and monitoring our own practices for appropriate opioid prescribing. But again, we know the data shows that's not going to be enough to solve this epidemic. We can't intervene and help patients with their opiate use or opiate use disorders if they're passed away from an overdose. And so direct opioid overdose prevention is really key as well. So it's important for us to be aware and know about opioid overdose education and naloxone distribution, to co-prescribe naloxone with anyone that we're prescribing an opioid script to. To help facilitate in our communities naloxone distribution to lay and professional first responders, and support appropriate prescription drug disposal and give back programs. And then the focus of these trainings is really on intervention and linkage for treatment, to treatment for people with opiate use disorders. And that means real-time access to treatment, not, you may have just suffered an overdose, come back, it was an effective response, and you're ready to engage in care, but that's going to be 3 or 4 weeks down the road. It's really about trying to get these individuals into care right away. And to do that, we have to have more providers trained to provide this care and willing to provide this care in their practice. And we do know that medications are the gold standard now for treatment of opiate use disorder. And we have 3 FDA approved, 2 of which can be provided right in primary care settings, buprenorphine and naltrexone. And again, those will be our focus next week at the Waiver primer training, and I hope to see you there. And I'm happy to take questions and provide responses or answers or additional information as warranted.
Well, thank you so much, Dr. Kowalchuk, for your presentation and giving us an overview of the opioid epidemic here in Harris County and what we're trying to do to help overcome this. So I would like to announce that next Tuesday we are hosting this MAT waiver training, and if you're interested in signing up, you could visit our website at doctorsforchange.org, and by visiting our free MAT waiver training link. On this link, you'll be able to get a bit of a description of what this training session consists of, and even see the recap of the video that we're shooting right now. And lastly, you'll also be able to enroll in that actual training session by clicking on the Enroll Today link, which will take you to our Eventbrite page. So we highly encourage you to please join us, please register, and share this with your colleagues as well. We really value everyone's input and everyone's involvement in this training session. So as far as our Q&A, we could proceed with any sort of common questions that we've come up with. This is our 6th session that we've had, and we know that we've had some various questions from different folks who are interested but unsure and a bit hesitant about getting involved. So I would like to hear some of the common questions you've heard and some of those responses as well.
Yeah, so I think the biggest questions really, revolve around, I'm not sure this really fits with my practice. I know that the opioid epidemic is a problem. I may have personal or professional experience with folks dealing with opiate use disorder, but I'm not sure how that fits into my practice. I might feel like I don't have the time to incorporate yet another thing, especially in the midst of an ongoing pandemic, into my workflow. I'm also a little nervous about, is my practice going to become known as an opiate treatment practice, and will that cause impacts to other parts of my practice or influence how my quote-unquote regular patients view coming and being part of the practice. There's been some of late, more recent questions around, I'm primarily now practicing virtually. Is that doable in terms of treating opiate use disorder patients? And so the training next week will address all of those questions in more detail, more directly, and hopefully offer some solutions to any problems or challenges that you might encounter trying to implement this life-saving treatment into your practice. I can say that many primary care providers have decided to incorporate this into their practice across the country and have lots of experience and have troubleshooted a lot of the concerns that people continue to come forward with providing this care. So it is doable, very doable within a primary care practice. We are currently able to do this work, at least in part virtually, with our patients. And so that's been a real positive thing coming through this pandemic and being able to continue some treatment services through the pandemic. Again, I encourage you to tune in next week and come to our waiver training primer. In April, the FDA relaxed and the DEA relaxed their regulations around X-waiver prescribing. And so you no longer have to complete an 8-hour course to get started doing this. So if you feel like, I don't know if I want to dedicate 8 hours of my life to learning this, then being able to prescribe, you don't need to do that anymore, but we'll have enough information in our 2-hour time together next Tuesday evening that you should feel pretty comfortable getting started after that. And we'll talk all about how to do that.
Absolutely, and thank you so much for giving us a bit of an overview of the common questions and sort of things that physicians and other folks kind of ask about in regards to this training. Now, I do want to also point out that if anyone at any certain time just has a question they would like to email us, you're welcome to email us at my email is info@doctorsforchange.org. So if there's any time you have a questions, even past this event, where you would like to learn more, please reach out to us. We do have wonderful resources available, and also a wonderful, instructor to help us, give us a really good overview of how to, do your part in regards to the opioid epidemic. So as far as any other closing remarks, I do also want to open up that door for you, Dr. Kowalchuk. If there's any other closing remarks before we end the recording.
I just hope to see as many folks as possible next Tuesday. Stay safe.
Awesome. Absolutely. So thank you so much again for joining us, Dr. Kowalchuk, and I look forward to seeing you on next Tuesday.
Thank you.